the Way of the Movement Professionals. This is a series of interviews, and I'm so happy to be spending some time today with Dr. Mary Hastings, who is a professor of physical therapy and orthopedic surgery at Washington University in St. Louis. Mary, thanks for your time today.
Thanks for inviting me.
So we'll dive right into the first question. I love this question because it's the origin story. How did you first decide you wanted to be a physical therapist?
Well, as I look back on my journey, I've realized I have been a person who's mostly followed curiosity. And I've never been a person who from day one knew what I wanted to do. But I had some interest in athletic training as a kid, and my mom was convinced that work schedule was not the best. Particularly, I think, for a woman who I'm guessing she thought would someday want to have kids. She didn't say that, but I'm sure she was kind of thinking that. And she's like, Mary, I really think you would want to be a physical therapist. And I've set you up for a time to, talk with somebody I know. And I did that, and I thought, oh, it was okay, but I still really want to be an athletic trainer. So I just went ahead and signed myself up for athletic training classes in college. I didn't really talk to her about it or anything. And then I got done with undergrad, got my athletic training certification, and I decided there was a lot of stuff I didn't know that I thought I would learn in physical therapy school. And most important was I did not understand modalities. So for all the reasons, I went to PT school to learn more about modalities. And I went to Wash U. Like the worst place to go to learn more about modalities. So anyway,
Good luck.
Once I was in PT school, I went to PT school to be a better athletic trainer. And then every clinical situation I was in, I thought it was great. I loved inpatient. I loved neuro. I loved rehab. I loved hand therapy. And so, I dabble occasionally in athletic training, but mostly it's, PT and geriatrics. I mean, that's really a lot of what I do.
Yeah. Wow. I love the little background on the big background on athletic training because I was actually wanting to become an athletic trainer myself. My undergrad was so small, we didn't have an athletic training major. So I found my way into PT, which I'm very happy about. But yeah, that's very cool. Your special interest is in the foot and ankle, and there's so many people who probably helped you help grow you to be where you are. Who were some of the most influential people in your physical therapy career?
Yeah, you know what? People are the reason, aren't they? Like, good people can draw you into anything. They can make anything fun. They can make anything challenging, and make it be something you want to do. I sat next to Michael Miller in the clinical practice area, which used to be in the Irene Walter Johnson building. And I think maybe it was my first day at work. He's like, Mary, you did this great assignment in orthotics prosthetics. I thought you just did a great job. And would you want to help me by lab assisting in that class? Right? Like, I did a good job on an assignment, which is, I think, also really something important, which is it doesn't matter what you're doing, whether you like it or not, or you think it's your future or not, do a good job, because those things lead to something else and you won't even know it. You won't know what you missed if you don't do a good job. You will know what you gained by doing a good job. But it doesn't, I don't know. I struggle with folks who are like, well, I did bad school because I didn't know what I wanted to do. I'm like, you can still not know what you want to do, but do a good job, because it will lead you somewhere better than doing a bad job. So I caught his attention with a silly right? A silly assignment in school. And so I started lab assisting, I think probably my first week of practice. Um, and I didn't care about the foot and ankle in particular, but if you can't think of a better group of Michael Miller, Dave Cinecord, Jay Diamond as people who are welcoming, push, right? I mean, they push you to be something better and different than you are. What a great group. So, I think that's, and it was, I decided as I've looked back, I like to make things. I like a product.
Oh,
Um,
okay, cool.
right. Like when, I don't know how many days you have like this in PT world, but I had a lot of days where people just weren't better. And it can be really disheartening where you're like, okay, I don't know what else to do. But look at this great orthotic I just made you.
Mhm.
Like, you might not be getting better, but I made you a totally awesome hand splint, or, so I kind of liked that creativity part. And I liked that there was always something positive that would come out of an interaction. So that was it. Probably the other reason, or the other way I kind of became involved was, I also wanted to learn how to cast, so I started doing diabetic foot stuff, you know,
Yeah.
so I really just took whatever opportunities came my way, tried them out, see what
Hmm.
stuff, moved on. But certainly Michael Miller, Dave Cinecord, Jay Diamond, those are my foot parents.
Oh, hearing their names make me so happy.
Yeah.
So you love to use your hands, very, very crafty with your hands. And my follow-up question for you going into your teaching career was that you really started lab assisting at WashU PT program really soon after graduating from PT school. So like first week into your job. It sounds like Dr. Miller really kind of reeled you into the teaching side. Did you think that you were gonna go full on into the academia and teaching?
You know, um, when I was in PT school, I thought I would make a really good lab assistant. Like, I'd already pegged myself as a pretty good teacher. I was pretty good at taking what had been taught in school, summarizing it, making sense of it, and then, I would be studying in the library the night before the test. I would be actually reviewing stuff the night before the test, but my fellow classmates were often there looking at the material for the first time.
Oh no.
Um, you know what I mean? One of those. And so they'd be like, Mary, I don't understand this. I'm like, did you not hear my question in class? Right on this topic. But anyway, I was pretty good at just summarizing information. I don't know if I helped them do better on the test or not, but I had already made sense of it in my mind. So I feel like I've always been pretty good at that. Um, and so I chose the job I took at BJC because it had a close connection with WashU. And I was able, and they were able to come over, do lab assisting. That's really the only job I had in mind. And I was even resistant when Michael's like, well, Mary, you're on my grants like 60%. Don't you want to just come and be a faculty member at WashU? I'm like, I don't know. Now I look back, I'm like, Mary, what, what were you thinking? Um, but so eventually I was doing so much at WashU that, I transferred over. So, and then the rest is just me following opportunities. And I love to teach. I love teaching my kids how to ride a bike. I love that joy that comes from the aha, or the I can do, that confidence feeling that you get when you teach somebody something. So that's how I got, I think that's what it resonates with me, how teaching resonates with me.
Yeah, yeah. And I find that the more we try to teach, the deeper understanding we get
Yeah.
of whatever material that we're trying to explain. So I love that aspect about
Yeah.
teaching.
Well, I still learn something about anatomy every time I teach it. And I've been teaching that for like, I don't know, 15, 20 years. It's not new stuff. They're not coming up, they're not discovering new anatomy,
Mhm.
but either I forget that I learned it, which is probably more common as I get older, or my understanding of its potential importance grows. And so then it feels like new information because it's a new way to think about something. But you're right. You continue to learn something. You continue to, I don't even catch like blanks in your understanding that you didn't know were there unless you try to explain it to somebody and they ask you questions. Then you see a blank, a gap, a gap in knowledge.
Yeah, wonderful. Going back a little bit, I was curious when you were getting your athletic training uh, major, were you interested in that because you had played sports growing up? Any injuries that you experienced that also sparked interest into rehabilitation or physical therapy?
I've been thinking a little bit about this because like how experiences as a kid provide you with opportunities to see things, experience things, and potentially change your pathway. Because I was thinking about in one of the classes right now that the students had to put out topics of interest, and like all of them were like, well, I had an ACL injury as a kid, and that's how I saw my first physical therapist and how I was inspired to be a physical therapist. And so, my special topic I want to study is ACL prevention. And I thought, now, if we start preventing all ACL injuries in young people, no one's going to be exposed to PT. Right? Like we're
Yeah, it's
we're
so
gonna
funny.
we're
Good
gonna have
point.
to figure out a new, because how many essays and admissions are all like, well, I had this ACL injury, and I'm like, so in part we'll have to figure out a new way to get exposure to us than than ACL injuries if we are successful at preventing them. But my first exposure to PT was I was a gymnast and I was having knee pain. And my coach was married to the college coach, gymnastics coach, who had access to the college athletic trainers. And so there you go. I got an appointment. I'm like, this is awesome.
Yeah.
I got pretty good at taping my teammates' ankles. I thought that was a lot of fun. Again, a very tangible product.
Yes.
And so um, I think that was my exposure. And I do think it takes an exposure. It takes, whether it's, media or your own personal experience, before you're like, oh, that might be something that might make me happy for the rest of my life or some long period after that.
Sure. You definitely want to know what you're getting yourself into and have that understanding of what this is about. So yeah. Yeah. Well, thanks for that story. I
Yeah.
had no idea that you were doing gymnastics when you were younger, so that's pretty
Yeah.
cool. Now, for those of us who are not too familiar, please tell us about MSCI and how you decided to pursue that degree.
I have this joke, if you're at WashU, you will get another degree at WashU. That's like I just keep getting degrees. Um, so I was working with Dave and Michael on their research, and we had an outcome of a study, and they're like, we totally need to ask this next question, Mary. We think we don't want to write it. Neither of us want to write it. We think you should write it, write up this grant and do this study. And so,
Mm,
I have rarely said no. So I said, okay. I wrote it. I got a perfect score and I got it funded the very first time.
wow.
Yeah.
Wow.
It was a
That's
great,
incredible. I know
yeah,
you're incredible, but that's
I
incredible.
know. It was an absolutely fabulous question, right? I had great mentors that read it. We wrote it together. I write, I think, for a person to, I don't always understand things, so I write in a way that people can understand, I think, what I'm talking about. And I was able to convince them that it was a great story. It's a great idea. Um, and as I implemented the grant, I realized I don't have the research training. to, like I can tell a stats person run stats. I could tell them I need you to compare the groups. But then when they would ask me other questions, or if they would produce the stats, I would struggle to read them. I didn't really know important things about study design. I had, through practice, I knew how to kind of move a study forward. But I didn't know a lot about grants management. And so I decided I needed more education. I if I were going to do it again, I think I would figure out a way to get a PhD, but maybe there wasn't a way for me to do that. I didn't want to lose my benefits, that help, are currently helping pay for my kids' college.
Yeah.
I didn't want to go part-time or have to stop school or stop working. I already had kids and had mortgage and car payments, and kind of felt, trapped isn't the right word, but I didn't have a lot of options. So at the time, I was going to have to quit my job in order to get a PhD. And so this was a way to add in the extra training layered on top, and get the additional training in statistics, study design, idea development, grant writing skills. All of that came through the MSCI. So that's a Master's of Science in Clinical Investigation. So a very clinically based, or a research program for people who already have a doctoral degree in a clinical area of expertise. So MDs, OTs, PTs, speech, anybody who has a doctoral degree, a clinical doctoral degree. So it layered on the research component of it.
Yes, and that totally makes sense with at the time of your current life situations, and that's great. And before we started this conversation, I know you mentioned getting another huge grant, so all is working out well.
Yeah. But if other people are thinking about following my path, I would push them a little to try to figure out the PhD.
Mhm.
There's a lot of I don't know, struggle without it. That is, I don't think it's worth it. I think I have a PhD over and above, like in what I have done with my life. Like if you looked at my CV, it would look like I should have one of those, but I don't. And it's still a barrier.
I understand. Yeah. Well, you're the kind of person who make the most out of every situation given, and so yeah, I'm really happy for you.
Thanks.
And
Yeah. Very exciting.
well, tell me about what cool and exciting research you are working on right now.
So as I look back at choices I didn't realize I was making, I have almost always pursued components of grants that really delved into the anatomy, the deterioration of that anatomy, or the injury of that anatomy and its impact on movement. That has always been kind of like, oh, well, if there's two different projects, Mary, you could do this one or this one. I'm like, oh, this one really interests me. I've pretty much always made decisions in that direction. It's not always been in kind of like probably as tight of a package as people might really expect. But so I have spent the good deal of my career developing or using methods to measure deterioration of the musculoskeletal system.
Mhm.
So either that's muscle volume, fat volumes of lower calf, leg, foot area, deformity. So using X-rays or radiographs to measure alignment and deformity of bones and joints,
Mm.
and also changes in bone density and its relationship to alignment and movement. So always, none of those are important unless it impacts movement. So they're always like the loss of muscle function on movement or joint deterioration, those kinds of things. So, and it's always been using the model of diabetes and neuropathy. Um, and I don't want to say I don't have a passion for diabetes and its complications, but it is a wonderful tool to study kinesiology, anatomy, and movement, that is fundable. And so it's just it's a way to kind of do the things I love. So the current grant I have just received funding for is in partnership with Dave Sinecor on the East Coast and Victor Chu on the West Coast. So we span the entire time zone spectrum of the US. And we are going to study the interrelationship between diabetes, kidney disease,
Mm.
on bone changes in people with
Yeah.
diabetes and neuropathy. So one of the exciting parts is using technology called high resolution peripheral CT. And you know how we know a lot about bone density, but when you look at a bone, you don't necessarily know how good is the bone made. So what is the cortical thickness? How many, and what is the formation of the trabecula side
Mm.
of the bone? And so this high resolution allows us to measure the quality of the bone, not just how much is there, but is it in the right places and in the right spots with the right connections. So
See.
really excited about looking at some of those changes because I think they probably happened prior to, almost like the volume of bone maybe doesn't change, but it goes into the wrong places, making the bone weaker.
Oh, wow.
You know what I'm saying? So sometimes bone density in people with diabetes is found to be higher than other folks, but they have a higher risk of fracture. And so if
Huh.
so that's the current grant. And then I'm really interested, the other thing, I haven't got it funded yet, trying to figure out, sometimes you can have great questions but not a way to study them in a clear way. But I'm very interested in how adaptive is the muscle of people with diabetes and neuropathy. Can we do something as a physical therapist to strengthen the muscle, or is it too far gone? How do you know if it's at some point? It probably is, but what is that point? And what are we doing with physical therapy when we try to strengthen a muscle in a person with diabetes? Are we actually making the muscle stronger? Are we changing the innervation? Are we changing the blood flow?
Mhm.
Changing the the ability to metabolize nutrients. So I don't know. That's my next poke at a grant.
I'm sure you're gonna come up with a way that can be funded.
Yeah. Yeah. Or tell the story in a way that they, think, oh, that is a great way to think about that. You gotta be
Would
creative.
would you say grant writing is almost like trying to tell the best story so people resonate with you and just want to give you the money?
It is about storytelling. I mean, I think that's all about, and I wanted to quit school. I remember it was probably like fourth or fifth grade. I asked my mom when is the earliest I could quit school? And my mom said, well, you have to get through the eighth grade. And
Okay.
I'm like, well, that's when I'm quitting school, right? As 8th grade.
Mm.
And I just I was bad at school. Um
Get out. Come on.
Horrible at school. I couldn't spell. I was in
Ah.
below level reading through 5th grade.
Mm.
Just not I don't know, maybe I had ADHD and I didn't know. I kind of have that personality where I quickly can move from idea to idea and I struggle sometimes to sit and concentrate. So we didn't have those words when I was a kid, but I struggled. And so here I am. How many degrees do I have? Like I've gone to school, like I think I'm like through 37th grade or something like that. Um, but where was I going? Your question was about what
Well,
was
it
your
was it about storytelling when you write a
storytelling? I was horrible.
yes.
I'm a horrible writer. I have to rewrite every sentence a million times, but I think what comes out of that is it ends up being clear writing in a way that people understand the story. And this need for um, leading people in a direction with your words and the way you summarize things. That's all about what it is having a story that people understand. That has not been an easy skill for me to learn. And every story is different. It's not like you have well, at least for me, I don't have a formula for telling a story and making it. I gotta live it a little. I gotta really understand it
Mhm.
to make a better story.
So at what age or something happened that kind of convinced you I'm going to stay in school? How did you turn that around?
It might be insecurity.
You think so?
I sometimes I do. I think, I never feel like I know enough.
Mm,
And it's taken me a long time I kept taking classes even after this last degree. And then finally I'm like, it's really hard for me to actually learn statistics unless I have my own data with my own questions. And then I can do the statistics. Then it means something to me. This class where I pull in I don't know, it's always drug studies. It seemed like it was never stuff that, the examples were never stuff we actually study. I'm like, well, if you ask me to compare two drugs with a statistical test, I could totally do that from class. But you give me something that's a little more complex in the PT realm. I couldn't do it. So at some point, I think I just decided if I need help, it's okay to have a collaborator.
yeah.
I don't have to know everything myself, because just because you don't know everything yourself doesn't mean that you're less of a person. You just say, I don't understand what you're saying. I've gotten pretty good at like just saying when I don't know what's going on, and being okay with not knowing and not being the person that has to know. I'm also pretty good at picking collaborators, who are hardworking and dedicated and know their science really well. And I bring what I know to that. They bring what they know, and we a, make a product out of that, make a relationship out of that. Um, so I think at some point I just got a little bit okay with just not knowing everything myself.
Yeah. Yeah. Yeah, that's so true. We can't possibly know everything, and that's what, especially at WashU, I think it's got such a strong culture of collaboration, teamwork. No one's
Well,
super competitive.
what else is I think I learned, like, I don't really want to know anything about your area. you know, you know what I mean? Like, I'm good not knowing MR physics. That's all you. And, you know, I,
You do you.
you do you. Please, and just bring me along and I'll bring you along on my side. You bring me along on your side. But yeah, I don't understand how spinning water makes images show up in MR.
Yeah.
I don't
Yeah.
understand how phone calls work. Right? Like, I don't know. I've tried to understand electricity and I just don't get it.
Yep, yep. It's all good. We don't have to know every single thing.
No, I feel bad I don't understand electricity and phone calls, but
Or Zoom, this Zoom call, Mary.
like your mouth and your noise is coming across at the same time. Like it used to be long distance calls. They didn't happen that way. It's shooting them into space. I don't know.
It is. Yes, we do have incredible technology
Yeah.
these days. So looking back from where you're standing, what kind of advice would you like to give to your 25-year-old self? And 25, I just kind of randomly picked, as that was kind of towards the beginning of a lot of physical therapist career. But
I think, what did my 25-year-old self need? Well, some of it I probably still need for today. I still need to just enjoy um all the great things that are happening. Um I don't know what else I would need. I think I think I did a good job of saying yes to the right people. Um and I don't think I turned down any really great opportunities. What else does my 25-year-old self need? Well, 3 children. It required me to have 3 children to give up stupid crap. You know,
okay.
so I just held on to a lot of things that I thought were important that are not important. The control. It's all about control for me. So things, I don't know, things that just don't matter, but I thought they did. But after 3 kids, you don't have the time to worry about it anymore. So you have to let it go. Like you don't have a choice. And so that really streamlined my life a lot. Like, you know, I I learned like not to care about like whether my kids' clothes match. Like I'm just happy you're dressed, kind of thing. Um and I learned a lot I've learned a lot from being a mom. From just, letting people make mistakes. Um, like, sorry, that's your deal. That I brought you this far. So some of it's just, again, it's probably letting go of control. When you're um, too busy to control all the parts, then it's like,
Yeah.
well, you're fed, you're clothed. So maybe that's what I give my 25-year-old self. Give up, give up the control earlier, but I don't know if I could have learned it.
Yeah.
I'm sure
Well,
somebody told me that.
this is hitting really hard on me because I have control issues. And so when I don't have children, Mary, just
I,
4 cats. And so I am really trying to take in your word deep in my heart because I do need to let go of some things that it just, you know what? It's as my wife would say, Maiko, that's small potatoes. Let go of the small potatoes.
yeah. Like, how do you
Have
know
bigger.
that's a small potato? That could be a huge potato, right? But like, I have some funny, I think, mom perspectives. Like, when my kids went to college, I'm like, there are just I want you to graduate, obviously, from college, but also there's really just 2 things that could happen in college that could mess you up, meaning limit your choices, prevent you from doing all the great things or all the things you want to do in the time that you can do them. And one would be being convicted of a felony.
Mhm.
Like a felony conviction just just really limits how many things you can do, and having a baby before you want one.
Mhm.
So avoid those two things. Like all the else, I want you to do good in school, but if something happens and you mess it up, you can try again,
Mhm.
but you can't
Mhm.
try again on the felony conviction.
Yeah, it
You,
is
you
a
know,
huge mark. It just doesn't go away. So that's
yeah.
tough.
So that's easy, small potatoes, right? These two things, big potatoes. The rest, the rest, they're medium and small potatoes. But sometimes I think it's really hard to figure out what the small potatoes are.
Yeah, yeah.
But it's good
It,
to have somebody in your life who can see them.
that's why I can't live without Michelle. So yeah,
Yeah,
absolutely.
we all need that help.
Mhm.
Well, and good friends tell you that too.
That's
You
true.
help you
That's
let
true.
go of, because some of it's also letting go of anger or guilt or fear. Like that's, you need to let that go. you
Mhm.
know, Friends can
Mhm.
tell you that too. So
Yeah, yeah.
surrounding yourself by good people who are
Well,
who are honest with you, right? I mean,
that's right. That's right. And who say the honest things because they care about you. Yeah.
yeah, yeah, not because they want to hurt you.
Yeah. Oh, well, so many great advice, Mary. I always find it so fascinating to, to learn how people got started in this
Mhm.
field I care so much about and where they're headed. So I'm really looking forward to your presentation about the foot and ankle, specifically on the pronation syndrome, for the Japanese physios in December. But yeah, thanks. This was such a fun conversation,
Yeah,
and
well, and I think you're a great example too of the the crazy directions you can go with a PT degree. I so most people's first encounter with PT is as a physical therapist in a clinic. Um, and that's just one thing a physical therapist can do.
Mhm.
You can be one physical therapist that does all kinds of different things. I think that's a great thing about our profession.
Yeah, yeah,
Yeah,
so many routes to influence others. Yeah.
yeah. You could start your own business and do continuing ed in two languages, for example, right?
I never saw that coming at
No.
all, Mary. Seriously. Yeah.
Did you like your business plan when you did it in school?
We the business plan that we put together was to open up a dance, a performing artist clinic. I remember that assignment.
Yeah.
But
Did you think you would ever need a business plan education?
I no.
Yeah.
No, I
That's
was fully gonna be like just spending time with patients 100%
yeah.
of the time.
It's hard to tell young people. I know you don't think you need this skill,
Mhm.
but everybody needs to know how to put together a business plan. Whether
Yeah,
you're pitching an idea or pitching a clinic or trying to run a grant, you got to know how to manage a budget.
that's true. And again, it boils down to how well can we tell our story so that other
Mhm.
people will resonate and support, whether that's the grant funding or finding great team members to collaborate. It's all about, okay, we want to work towards the same goal. Yeah.
Yeah. Well, congratulations to you too. You do great work.
Um, Thank you so much, Mary. That means a lot coming from you, and I've taken up enough of your Friday evening. I hope you have a good weekend,
Thank you.
and
Well, all three of my kids are home, so that's what I'm doing this weekend.
get
Yeah.
home soon. Thank you so much for your time, and we'll talk soon, Mary. Thanks a
Okay.
lot.
You're welcome. See ya.
Okay. Yep. Bye bye.